Okay, the third point, improving mental health and well-being and prevent substance abuse. That is one of the main objectives, of SDG 3. And like WHO, as per WHO, a person is not considered healthy if only physical health is good, right? It's a combination of both physical and mental health. Then only we say a person is completely healthy. Now, coming to this point, the to achieve this SDG 3, it aims to strengthen the prevention and treatment of substance abuse. When I say substance, including narcotic drug abuse or spreading awareness about, there are harmful effects of alcohol consumption. And in this aspect, already government all over the countries, they have having implemented many policies to regulate alcohol marketing, reduce the demand, raise awareness about the harmful effects of alcohol. And to share a hard facts with all the listeners, the survey says that tobacco itself can kill as many as 1 billion people in this century, which is alarming, right? And smoking causes half of all deaths in 12 different kinds of cancers and can specifically cause 80% of lung cancers because of smoking. So many rehab centers, NGOs, government together, they're working towards this de-addiction programs, especially awareness in teenagers and our young generation. Now, the fourth point, access to essential medicines and vaccinations. When we say that to achieve the goal by 2030, every country required to strengthen their health system and ensuring universal health coverage, which talks about the availability of essential medicines and vaccines for all human beings, right? Again, the survey says that more than 6 million children globally die before they reach the age of 5 years. And this number is alarming because one of the main reasons behind it, because they don't get either vaccination at the right time, or vaccination, or they don't get the required immunization at the right time, right? Coming to the fifth point, providing healthcare to vulnerable population. Again, when I say vulnerable population, it's actually, again, the women, young children, people living in rural areas who cannot access the medical facilities very easily, and elderly people also, and those who face health emergencies, what to do at that point. And when I say elderly, I think all of you will agree that not just, people who are not able to access, even people who are living, elderly people who are living in urban area. Suppose they're living alone and kids are, due to job requirements, they are away from their parents. And in case there is any emergency, how easily they are able to access. And there are many programs where they are helping in with one call, medical emergency reaches to these elderly people. But I think this stepwise is going. We are still at a baby step. And many NGOs are also working towards that, where one phone number we call and medical facilities immediately available to elderly people in case of emergencies. Reducing maternal and child mortality, again, an important point as per SDG 3. As per the reports, the number of mothers dying during childbirth have reduced almost to 60% globally, which is a good sign. And this again attributes to the advancement in the health system globally, not just in our country, globally. But still, more than half of the women in developing countries, they don't have the access to sanitary facilities, which can be a main cause of, especially in maternal death or child mortality. This including providing access to skilled birth attendants, people who are dealing the birth time. They are how skilled these people are, ensuring safe and timely management of pregnancy complications, proper care and nutrition at the time of pregnancy and after, like postnatal, both for the mother and for the child. How can we, moving on to the next point, how can we lessen or mitigate the impact of health emergencies such as pandemics and natural disasters? Here, again, it's very fresh in everybody's mind, COVID-19 pandemic, how we all tackled, even though it was a scary scenario for everyone. But I think talking about our own country, India, how we all stood together with, especially with the help of, our medical facilities, how we all tackled it, the COVID-19 pandemic. And global countries realized that strengthening the health system, improving sanitization, increasing access to physicians, supporting and funding research on vaccines and medicines, that was all the learning of that actually COVID-19 has taught us. So as the name suggests, this SDG aims to improve people's health, ensure their well-being. And I think it's not just one person or one, one country or one government working together, we can improve. And we educators now discussing these points, I think we are also a big contribution towards, helping achieve the SDG 3 goals. Thank you, Aarti ma'am.
Truly said, ma'am. Today we have World No Tobacco Day as well. 31st of May is celebrated for that. So we all let's have a pledge together and promise ourselves that we should not go for such acts which are against our good health and well-being. So, before proceeding further, I believe good health and well-being leads to holistic education. So, is it correct, ma'am? What do you feel?
Absolutely, Aarti ma'am. As educators, I think we are the right example who can promote this quote, I would say. Before starting this second the part, actually, I feel this quote suits prevention is better than cure. And I think we educators in our education system, how we can impart or spread awareness in our students, right? And how we can promote that connectivity between the, well-being and academics. So as the picture, you all will agree that the picture actually speaks for itself. The kids who are having nutritious foods, at the same time, they look happy. So it's a combination of physical as well as mental health that shows that. And when a child is healthy, both nutrition way and at the same time mental well-being, we can see that their academic performance is really, really high. They are good contributors in the classroom. They're actively engaged, and somewhere, their absenteeism comes down. They love to come to school and they attend school regularly. So many factors, which is a combination of both what we call health as well as mental well-being. So the attendance, performance, and also they can achieve more better in terms of academics. How we can achieve that? By incorporating this good health and well-being topic into our various subjects, into our curriculum as such. For example, science, we all know that there are already inbuilt topics. For example, how they study about diseases, they study about vaccines and all that. Also, physical education talks about uh, healthy lifestyle, incorporating yoga, right? All this promote healthy this thing. And a few examples to share that already NEP 2020 talks about elementary ECCE, where children will learn in terms of play-based method itself, which shows a mental well-being of students in the school. They enjoy their classrooms, raising awareness about mental health. It's We cannot call a person, like I said, until the person is not feeling mentally healthy also. So we have to share awareness, not just in students, but also in parents, that how we can have that atmosphere, healthy atmosphere at home also. Although we are doing that in schools, but we need, it's like a hand in hand, it goes together. The child should be feel supportive, child should feel a secure atmosphere at home also, right? And many schools, they call lecturers or workshops. They conduct workshops, invite professional people to talk about healthy lifestyle, the importance of good nutrition, disease prevention, importance of sexual education and mental health care, and many more. Right. So these are some examples that comes to